Hi, my name is Mary Cruz. I'm going to be the nurse practitioner student taking care of you today. What's your name?
I'm Bridget.
Oh, hi Bridget.
Hi.
Nice to meet you.
Nice to meet you.
Let me wash my hands before we get started. Okay. Tell me a little bit of the reason why you're here today.
I'm here because I feel like I've had some problems with constipation in the beginning of my pregnancy, but it's getting worse now.
Oh, okay. When was your last bowel movement?
Recently, I want to say in the past 7 days, I've only had 2.
Oh, okay. And how was your stool? Was it hard? Was it liquidy? Any blood?
It was definitely strained, hard to get out, but no blood.
Okay, good. No blood is a good thing. Have you noticed anything that makes you more constipated?
I have decreased my intake of water. I'm just not as thirsty as I used to be, so maybe that might have something to do with it.
And have you tried anything to help with your constipation?
I have tried drinking some prune juice, but it's kind of gross. I don't really like doing that.
Okay, and how would you describe your typical diet?
I eat about 3 or 4 meals a day. Pretty average meat and pasta, I guess. Typical American diet.
Okay, and do you exercise often? What kind of exercise do you do?
I don't really exercise as often as I used to. So ever since I got pregnant, I'm just feeling really lazy. I do walk every now and then. I don't know if that counts.
Okay. And do you have any other symptoms like nausea, vomiting?
No nausea, no vomiting. I do have some lower back pain though.
Oh, okay. And are you taking any other medications other than your prenatal vitamins?
No.
Okay. So let's talk about your backache.
Okay.
When did that start happening?
About a week ago, we were moving around some furniture. We're getting ready for the baby.
Exciting.
And that's about when I noticed it.
Okay. And then show me where it hurts.
About right back here.
Okay. Does your pain stay in that area, or does it travel? Does it move around?
It stays pretty generalized right there.
And what does it feel like?
Aching. Pretty achy.
And on a scale of 0 to 10, how much would you say it hurts? 0 being none and 10 being the worst.
About a 4 to 5.
4 to 5.
Yeah.
Okay. Have you noticed anything that makes it better or worse?
Resting definitely makes it better. If I'm standing up for too long, that definitely does aggravate it a bit.
Okay. And then do you have any other symptoms with the back pain, like frequency urinating, blood in your urine, or fevers?
No fevers, no differences in my urination, other than I probably don't urinate as often as I used to since I'm not drinking so much water.
Okay. And then any trauma or any injuries that you can remember? Did you fall down when you were moving furniture or anything
injuries.
like that?
No.
Okay. And then any numbness or tingling in your legs?
No, none whatsoever.
Okay. And any family history of any colon cancer or kidney stones?
No, none.
Okay. Let's review a little bit more about your past medical history.
Okay.
Do you have any allergies to medication?
No.
Do you drink any alcohol, smoke any cigarettes, tobacco,
No.
any drug use? Okay. Any traumas in the past, any hospitalizations
No.
or surgeries?
No traumas, no surgeries.
Okay. Any kind of illnesses, any medical problems like high blood pressure, diabetes?
I did have chickenpox when I was a child and high blood pressure my mom said.
Okay. So your mom has high blood pressure, and then what about your dad or your brothers or sisters?
Dad's pretty healthy. My sister's good health too.
Okay. Any genetic illnesses?
No.
No. Okay. Any diabetes? You said no.
No, no.
No strokes?
No.
Okay. And then what do you do for a living?
I work in an office for HR and, regular desk office job. And I live with my husband, so I would say I have a pretty safe environment.
Oh, that's good.
Mm-hmm.
I'm going to ask you now a little bit more questions about your sexual history.
Okay.
So when did you first start your period?
Probably when I was about 12.
Okay. And how would you describe your menstrual cycles? How long are they? How much do you bleed?
I would say it's pretty average. I usually cycle every 24 to 28 days, and my period lasts about 4 to 5 days. Average bleeding, nothing too heavy.
Nothing heavy. Okay. And then when was the first day of your last menstrual period?
July 26th.
Okay.
2014, I believe.
Let's check when you're due. So it looks like your due date is going to be about March 1st. So that makes you 32 weeks pregnant today.
Yay.
All right. Almost there.
I know.
And then, do you plan on using any birth control after your pregnancy?
Yeah, we were using regular birth control pills before, so I figure I'll go back to that.
That was working for you. Good.
Mm-hmm,
Okay, good.
fine.
And then any history of any sexually transmitted diseases?
No, nothing like
Okay. Okay, so I'm just going to take a quick listen to your heart and your lungs to start with. Your vital signs look good. Your weight is actually normal for your pregnancy, and before you were weighing 118 before you got pregnant, right?
Yeah.
And I think today you weigh
138.
38. So normal pregnancy weight for a normal person, that's an average size. You want to gain about 25 to 30 pounds for pregnancy.
Okay.
So I don't think your weight is causing your back pain, but let's check you out.
Okay.
Good. Let's take a quick listen to your lungs. Take a big deep breath in and out. Good. 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 I think it sounds pretty good. I'm going to feel your back. Let me know if you feel any pain, tenderness, soreness, anything, okay?
Okay.
Anything here,
No.
here,
Mm-mm.
here,
Mm-mm.
here?
Lower down. Yeah.
Right
about
here?
there. Yeah.
Okay. And what does it feel like?
Just like an aching.
Achy.
Yeah.
Okay. I'm going to tap on your back and let me know if you have any shooting pains or
Okay.
it brings on your pain, okay?
Mm-hmm.
Anything?
No.
Okay, good. And then your back looks like it's curved correctly. There's no abnormalities that I can see from here. So I'm going to have you lay back. And we're going to do some straight leg raises to see if that brings your pain on.
Okay.
So let me do all the work. I'm just going to lift your leg up and let me know if you feel any pain.
Okay.
So relax this leg. Any pain?
No.
Relax this leg. Any pain?
No.
Okay, good. I'm just going to measure your belly now. Right at 32. Perfect.
Mm-hmm.
And then let's check your baby's heart rate. Pretty good. It's about like 146, which is normal. And now I'm going to listen to see if I can hear any bowel sounds.
Okay.
Sounds good. I'm going to press on your belly.
Mm-hmm.
Let me know if you have any pain.
Okay.
Any pain?
No.
Any pain?
Mm-mm.
Anything here?
Mm-mm.
Here?
Mm.
No? Okay, good. I'm going to have to do a rectal exam as well as check your cervix to see if you're dilated. I'm a little concerned that maybe your backache might be some signs of preterm labor.
Okay.
So I want to make sure that your cervix is still closed.
Okay.
And then I want to make sure that you're not impacted because you haven't had a bowel movement in a long time.
Yeah.
So. Go ahead, bend your knees. Good. So have you picked a name for the baby yet?
We're still on the wall about it. We are looking at some baby book names and his father's name, so we'll see.
Okay. Little cold gel. Okay, your cervix is still closed. And you didn't have any pain when I was feeling in there, okay?
Mm-mm.
Let me wash my hands real quick. Okay. Now when I do the rectal exam, it'll just be a little cold gel and you'll feel like pressure.
Okay.
But let me know if you have any pain.
Sure.
Okay, a little cold.
Ooh.
Any pain?
No pain.
Okay. Well, there's a little bit of stool, but no blood,
Okay.
which is a good thing. Wash your hands again. Okay, you can put your legs down there, get you covered up. And then you can sit up if you'd like.
Thank you.
So from my findings in your history, I don't think there's anything specifically that's causing your symptoms. I would like to get a urine sample from you to make sure that it's not a urinary tract infection that's causing your symptoms.
Okay.
And it looks like you just had blood work done, so I don't think it's your thyroid that's causing your constipation or any abnormalities in your calcium or your potassium.
Okay.
So I think all those things are good. With that being said, constipation and lower back pain is very common in pregnancy, especially when you go further into the pregnancy. And I think because you haven't been drinking enough water, that's making your problem worse.
Yeah.
So we really do need to make sure that you get enough water in. And so what I mean by that is you need to have at least 10 to 12 glasses of water every day.
Okay.
We'll start you on a pill called Colace. It's a stool softener.
Okay.
You're going to take that 2 times a day just because I feel like your constipation has been a problem from the beginning.
Yeah.
And I don't think simple fiber measurements are going to work well for you. So I think a combination of the Colace and the fiber and using Metamucil will really help your constipation. So with the Metamucil, you take a teaspoon, you mix it in with the full 8 ounces of water. The trick for both the Metamucil to work and the Colace is for you to drink enough water because it brings and absorbs the water into the stool so the colon can pass it right along. Okay? I do need you to exercise a little bit more, about 30 minutes a day for 3 to 5 days a week.
Okay.
If you don't like to walk much, you can try swimming. Swimming will help you, with the muscles and help you get that cardiovascular exercise that you do need in pregnancy. And then keep listening or feeling for your kick counts. Your baby needs to kick at least 5 times an hour.
Okay.
But I do want you to make a mental note of any signs of preterm labor because those are warning signs that will lead you to go to the hospital. So what this means is if you get any back pain that starts from the back, goes around you like a seatbelt, and your abdomen gets rock hard, that's a contraction.
Okay.
If you get those often, like 30 to 2 minutes in length, but they start coming every hour, or they start coming in, sooner, you need to go to the emergency room because we need to prevent you from delivering your baby too soon. So I'm going to give you a handout that describes that and also a handout on dietary measures for you to do.
Okay.
But other than that, I think that you're doing pretty good.
Awesome.
Try to, when you lift things up, try to keep them close to you because your center of gravity has now changed since your pregnancy. So if you're holding things out like this, it's only going to cause more strain on your back. So try to hold straight to you, lift with your legs, and then get help from your husband if you need to move things. Maybe have him massage you or do warm packs, to your back when you do ache. And then you can take Tylenol every 4 to 6 hours if all the other stuff doesn't work for you.
Okay.
Okay? I think that's pretty much it. Do you have any questions for me?
No, I think you covered it all. It's been great.
Okay.
Yeah.
Nice meeting you.
Nice meeting you too.
And make sure that you follow up with your OBGYN in a week
Okay.
to make sure to see if things are working for you, if we need to change something.
Okay.
Okay.
Sounds great.
Okay.
Thank you.
Mm-hmm.